Hoag is an incredible facility. It really has world-class medicine on many levels, in many different specialties and subspecialties. They've gone out of their way to recruit really good doctors, and that really makes for great medicine.
Hoag maintains that warmth, that individuality, the fact that it's in your backyard, and yet it has access to all of the different resources and technology that a traditional academic center has. And all of that happens because of philanthropy support.
Well, the healthcare landscape is changing, but healthcare is still healthcare. You know, what that definition is taking care of patients. But philanthropy plays a huge role because without philanthropy, we don't have innovation, we don't have new techniques, we don't have enough funding for education at the higher level.
When the future is changing, then we need to be able to change the course on there, and change requires some momentum and some energy, and that's where philanthropy comes into play. I think philanthropy helps us bring in new knowledge, bring in new skills, bring in people with knowledge and technology for us to make those changes.
It allows us to innovate and revolutionize the things that we do on a daily basis. It allows us to create state-of-the-art care for our neighbors.
At Hoag, we're fortunate to have a community that is willing to literally partner with us in providing health care. The partnership is so powerful that they are as indispensable to us, community philanthropists that is, as our nurses, our doctors, and our other affiliated caregivers.
My first experience with how generous people are was with one of my patients who had cancer, who I operated on, and it was a really difficult case. The patient ended up having a good outcome. We really fought hard to get there. And I remember it was maybe the second post-operative visit where the patient, he said how grateful he was for his care and that he wanted to get back. The first thing I did is I said thank you. The second thing I did is I made sure he was in contact with the appropriate people. And I ran into this patient at the Christmas Carol ball, and he looked like $1 million, and he's all shined up and just looks like the picture of health. And he said, yeah, he says, you know, I got in touch with the foundation, and now I'm a member of the board, and I'm a contributor, and I'm going to continue to be a contributor. And you know, he really took pleasure in giving back, and it does so much for him. And as his doctor, it does so much for me, you know. Our care is demonstrated in how hard we work for them and how much we struggle and how we're always striving to achieve the highest level of care. And the way they demonstrate they care for us is by contributing to our cause.
Perhaps the greatest joy as a physician is having patients come back to you and express their gratitude. So when you have a patient that expresses gratitude, that's the time, that's your moment, that's the opportunity to make the link in their mind and put them in touch with someone from the foundation.
You say thank you, you show appreciation, you show love and passion for what you do, and should that patient want to give back, give them the opportunity to have an impact on the world and be able to give others a chance to get the same quality care that they did.
Just be open to the idea that grateful patients do like to reciprocate the great care that they've been given and like to be involved.
Look around, see the effect of philanthropy, and see if you can help the foundation to get more generous donations that we can make it even better.
You foster every relationship, and wherever each one goes, it goes. And some of them are going to be incredible and wonderful, and they're going to make amazing things happen. Philanthropy makes the impossible possible.